Today I will talk about another subject related to the MCH. I will talk about infections during pregnancy. Learning objectives of this lecture. By the end of this lecture, the student will be able to define the infectious diseases during pregnancy and to enumerate main infectious diseases during pregnancy and to describe main route of infection during pregnancy and to discuss the immunization related to pregnancy. In addition to simple steps, we will mention simple steps for prevention and infections during pregnancy. I would like to say a few words about the infection. Human infectious disease caused by bacterial, viral, or fungal invasion of the body, which result in characteristic signs and symptoms of disease. Many infectious diseases are self-limited or radially respond to antibacterial or antiviral therapy in healthy, immunocompetent individuals. On the other side, vertical transmission can occur through transplacental passage, often resulting in severe congenital malformation and long-term disability, as we see in rubella and cytomegalovirus. Fetal infection can occur from ascending maternal infection of the vagina and the cervix, which is often the case in chorioamniotis. Intrapartum infection due to hematogenous spread or direct exposure during birth account for perinatal transmission of HIV or herpes zoster and group of B streptococcus. Postnatal transmission can occur also from breastfeeding. Pregnant women are at risk for the same infectious diseases as non-pregnant individuals and often have increased morbidity and mortality associated with infections. Thus, immunizing women during a pregnancy with recommended vaccine, for example, tetanus toxoid, provide direct maternal benefit. Furthermore, maternal immunization has the potential for both fetal and infant benefit by preventing adverse pregnancy outcome and infections during early life through passive immunity. Based on review data, WHO, World Health Organization, concluded that there is no evidence of adverse pregnancy outcome from vaccination of pregnant women with inactivated killed virus or killed bacteria or toxoid vaccine. Therefore, pregnancy should not preclude women from immunization with the assist vaccine if medically indicated. Here I would like to mention something about tetanus toxoid, which is the vaccine given to the pregnant women during pregnancy. First dose given during the week 20 and more, after 1 month another dose, and after 6 months the third dose, and after 1 year followed by the last dose, which is after 1 year also. So pregnancy affects every system in the body because of changes in the hormone levels, and immune system function can make the mother more vulnerable to infection and serious complications. Labor and delivery are especially also make the pregnant women susceptible for more complication in addition to her baby. Pregnancy also make these infections more severe. Even mild infections can lead to serious illness in pregnant women. Some infections that develop during pregnancy can lead to miscarriage, preterm labor, or birth defects. Other infections can be transmitted to the baby through the placenta or during birth. When this occurs, the baby is at risk of health complications as well. They may even be life-threatening for the mother. Most common infections that occur during pregnancy, such as those of skin, urinary tract, or respiratory tract, cause no serious problems. However, some infections can be passed to the fetus before or during birth and damage the fetus, or cause miscarriage or preterm birth. Also, whether taking antibiotic and other antimicrobial drug saved during pregnancies also has a concern. Regarding the types of infections during pregnancy can be classified into either sexually transmitted diseases that can cause a problem include the following. Chlamydia infection may cause preterm labor and premature rupture of the membrane. It can also cause eye inflammation, for example, conjunctivitis in the newborn. Gonorrhea also causes conjunctivitis in the newborn. Another disease, syphilis, can be transmitted from the mother to the fetus through the placenta. Syphilis can cause several birth defects and cause a problem in the newborn. Pregnant women are routinely tested for syphilis early in the pregnancy. Usually, a treatment of syphilis during pregnancy cures both the mother and the fetus. Another point, which is very important, HIV, a human immune deficiency virus, infection transmitted to the fetus in about 1/4 to 1/3 of pregnancy. If women who have the infection are not treated, experts recommended that women with HIV infection take antiretroviral drug during pregnancy. If women take a combination of antiretroviral drug, the risk of transmitting HIV to the fetus can be reduced to as low as 1%. For some women with HIV infection, cesarean delivery planned in advance may further reduce the risk of transmitting HIV to the baby. Pregnancy does not seem to speed up the progression of HIV infection in the women. On the other side, non-sexually transmitted diseases, infections that are not transmitted sexually and that can cause a problem, including the following. German measles or rubella can cause a problem, particularly in adequate growth before birth, cataracts, birth defect of the heart, hearing loss, and delayed development. Also, cytomegalovirus can cross the placenta and damage the fetus, liver, and brain, and the fetus may not grow as much as expected. Bacterial infection of the vagina, such as bacterial vaginosis, may lead to preterm labor or premature rupture of the membrane containing the fetus. Urinary tract infection increases the risk of preterm labor and premature rupture of the membrane containing the fetus. Hepatitis may be transmitted sexually, but is often transmitted in other way. Thus, it is not typically considered a sexually transmitted disease. Hepatitis in a pregnant woman can increase the risk of premature labor. It can also be transmitted from the mother to the baby during delivery and causing treatment. Sometimes drug depending on the balance of benefit and risk to determine whether to treat pregnant women with antimicrobial drugs. Doctors weight the risk of using the drug against the risk of the infection. Some antibacterial drugs such as penicillin, cephalosporin, and drugs related to erythromycin are generally considered safe for use during pregnancy. Other antimicrobial or antibacterial drugs, including tetracyclines and fluoroquinolones, may cause problems to the fetus, in addition to congenital anomalies. So, we can advise the pregnant women few advice for prevention of infection. Number one, maintain good hygiene and wash your hand often, especially when around or caring for children. We advise her to cook her meat until it's well done. Avoid unpasteurized or raw milk and food made from it. Talk to her doctor about vaccination. Get tested for sexually transmitted infection. Avoid people who have an infection. Protect against insects known to carry the diseases. Don't touch or change dairy cat little and avoid contact with potentially contaminated soil. Stay away from wild or pet rodent and their droppings. Thank you and good luck.